Bronchopneumonia is an acute or chronic inflammation of the lungs, in which the alveoli or interstitial are affected. Pneumonias are the most common cause of death among infectious diseases. They take the fifth place in the statistics of diseases causing death. Causes of bronchopneumonia: most of the times it is due to descens, which is going down, infection of the bronchi and an acute bronchitis. Inflammatory foci in different sizes are formed in the lung parenchyma, which contain purulent exudates when there are bacterial causal. These sections are hardened, grayish in color. They could be great number or merge between each other. Confluent pneumonia. Bronchopneumonia can also be secondary, complication of some other disease. Viral infection, influenza, measles, aspiration of food or vomiting, obstruction of bronchus with foreign body, neoplasm and others, inhalation of poisonous gases, major surgery, severe chronic diseases, tuberculosis, malnutrition, hypostatic lung lying after suffering stroke. Symptoms in Crypus pneumonia: the disease often begins after colds and the occurrence of lobular herpes. Sudden onset with fever and high temperature, about 1 week, bad general condition, cough, dyspnea, difficult breathing, with the participation of nostrils in breathing, brownish red sputum on the second day with plenty of leukocytes, chest pain when breathing due to the accompanying pleurisy, chest pain when breathing due to the accompanying pleurisy. Laboratory data: acceleration of AS, blood count, leukocytosis, increased leukocytes, toxic granulations, eosinopenia, reduction of eosinophils, lymphopenia, reduction of lymphocytes. X-ray examination: thick, comparatively sharply outlined large overshadowing. Symptoms in atypical pneumonia: slow start, headache, muscle pain, myalgia, little temperature, without fever, dry irritating cough without expectoration, spitting, weak auscultatory findings, rale is almost missing. Warning: lung percussion and auscultation penetrates in a depth of 5 cm. Therefore, the negative finding in an examination does not exclude atypical pneumonia. When there is an unclear case, lungs X-ray should always be made. Complications of the bronchopneumonia: septic distribution to the pneumonia agents through the blood with the development of otitis, meningitis, brain abscess, endocarditis, pleura damage, pleurisy, pleural effusion, pleural empyema, recurrent pneumonia, affecting other lung sections, chronic pneumonia, cardiovascular disease, respiratory deficiency, thromboembolic complications due to bed rest, acute renal insufficiency and dehydration. Treatment of bronchopneumonia: general events, physical calmness, when there is temperature, bed rest and thromboembolic prevention. Secretory means, breathing exercises, inhalation therapy, humidification. Treatment of heart failure: in the presence of hypoxia, oxygen through nasal probe is given. In the development of acute respiratory insufficiency, mechanical ventilation should be done. Sufficient imports of liquids, depending on the increased losses due to high temperature. Antibiotics after taking bronchial secretions. Sputum: an intentional treatment should immediately start without awaiting the results of bacteriological examination. Targeted treatment is started after receiving the results of microbiology, according to the antibiogram. If necessary, the antibiotic have to be changed. In severe cases, blind treatment of bronchopneumonia is undertaken with a combination of 2 antibiotics.